Dr. Vijayasri Murthy, or Dr. Viju, as she is fondly called, is a highly accomplished breast cancer surgeon. After receiving training in various institutions, including the Tata Memorial Hospital, she relocated to the US, where she has accumulated over a decade of experience. With a total experience of over 20 years as a breast surgical oncologist, Dr. Murthy specializes in surgical management of both benign and malignant breast diseases, including breast cancer screening, surveillance breast programs, and counseling and risk assessment services. She is also an expert in preventive surgery for hereditary breast and ovarian cancer and breast cancer genetics. She has received extensive training in breast surgical oncology, multiple reputed national and international medical institutes. Dr. Murthy is a member of several professional organizations, including the American Society of Breast Surgeons, the American Society of Clinical Oncology, and the Association of Breast Surgeons of India. She is also a frequent speaker at various national and international conferences. Dr. Murthy believes in a personalized treatment approach, taking the time to go through each case thoroughly and devise treatment plans that will have a positive impact on the treatment response, clinical outcome, and patient's quality of life. She is committed to providing her patients with the best possible care, and she is known both for her deep understanding of the subject and her empathetic approach to her patients. Currently, she serves as a consultant surgical oncologist, breast surgical oncologist in HG Kolaba. Ma'am, warm welcome again. Dr. Sachin Trivedi is a highly accomplished medical.
Namaskara. நீங்கள் எல்லாமே எங்கேனே உண்டு. So I think being somebody in the medical field, it has been more of a frequent question to us. Vedana undu, or in Tamil I am asking, vali irukka, irumal irukka. So now it is a little bit of a different thing when I am talking to all of you. I think a couple of things which holds me very close to this group is, one is that Reena is a very good friend of mine and she takes care of all my breast cancer patients. So the moment she suggested this, the first thing I said was, yes, let's come here and talk to all the people in the parish who Reena associates with. Thank you very much, Father, for giving us this opportunity on behalf of Mathrusangham. The other thing which is very close to me is because I was a student of Our Lady of Good Counsel High School in Sion. So I know that you are all from the Sion Antop area, so that also gives me a little connection with all of you. And I am a Kannadiga, but I am married to a Palakkad Iyer. So again, Palakkad is very close to probably some of you. So in every way, I think I feel a connection with every one of you here. So thank you very much for this opportunity. I think we've spoken a lot. Sachin has given you a lot of insight about what cancer is about, and uske bare mein a lot of information about why it is important and everything. But Joanne told me that I should go a little fast because he said there is good idli chutney waiting in that red box. So I thought I'll go a little faster with my slides. If it is echoing or something, do let me know. So I have spent quite a few years in this field. Most of my training I've done in Bombay, so I've done it in Sion Hospital and in Tata Memorial. And I'm sure almost every family here probably has somebody who is in the healthcare industry, whether it is nurses or physiotherapists or in any part of the healthcare industry. I think I have worked, whether it's in Bombay, it's in Bangalore at Tikva, in Tata Memorial, in US, everywhere. I think the moment you go into the operating room and there is a Mallu sister there with the instrument, it gives you that little conviction that your case is going to go on well. So having said that, I think I just want to brief, I'm sure all of you are already aware, many of you are probably nurses here. So I just want to touch briefly upon why screening is important, how you can be the spokesperson for your family members, for people back home in Kerala. Tell them the importance of screening, because this is one of those cancers which has become number one in India today, and why all of you will play a very, very integral role. Many of the men who are sitting here, again, if your wives or sisters or mothers have not come here for the talk, at least go back home and give that information. So I will just pay a little attention to, I'll briefly run through the slides, but I'll let you know why it is important. Next slide, please. Since everybody gave me an introduction that I have spent some time in India and in the US, I thought, okay, thoda sa let me, compare the statistics of India and US and तभी आपको समझेगा कि why this is important for us. Next. So this is just a little bit about anatomy of the breast. Again, I don't want to go into too much detail. What you are seeing in the purple color is actually the glands where the milk is formed. It comes through the ducts and it comes out through the nipple. That's how we do breastfeeding. The yellow part that you are seeing, the yellow part is actually just the fatty content of the breast. And why this is important, I'll tell you in a little bit. Next. So this is just the anatomy of the breast. What you are seeing in the green colored dots is what is called as the lymph nodes. That is why the first place where from the breast, if the breast cancer spreads, it goes to the armpit, and that is why the lymph nodes are important. Again, the importance of that I will talk to you in a couple of slides. Next. So this is the US statistic. So I was there in New York for almost 15 years, and वहाँ पे we were seeing 1 in 8 women get breast cancer. So that is the number one cancer in US also today. That means if 8 of us are sitting, one of us is going to get breast cancer. So let's see what's the picture in India. Next. In India, it is 1 in 28 women. So that feels a little bit hard. It's not so common, right? It's just 1 in 8 versus 1 in 28. But again, if you go to see, the population in India is so much that 1 in 28 also becomes a very important number for us. Next. So, for example, if you see that first line, in US, new cases we see about 2.8 lakhs per year. And the 5-year survival rate is 90%. The death rate is about 43,000. Next slide. What is the situation in India? In India, we see about 1.6 lakhs. That means half the number of cases, what we see in the US, we see almost half in India. So that should be a good sign, right? But problem is, 5-year survival rate in US is 90%. 5-year survival rate in India is only 60%. And if you see the death rate, in the previous slide it was 43,000, death rate in India is higher. It is almost double, it is 87,000. That means what is happening is we are seeing half the number of cases, but we are seeing it in such advanced stage that the death rate is much higher. And this highest incidence rate in Kerala is not to scare any of you. The incidence rate is highest in Kerala because Kerala may reporting higher rate. The only thing is a lot of the other places, hospital-based registries, their community-based registries, population-based registries are not so up to date. We should be proud that Kerala is at least up to date with their numbers. So that is why we are seeing the highest rate in Kerala. Next. So what do we know about screening? Screening का मतलब ये है कि before it becomes too much of a bigger issue, how do we screen for these cancers and try to catch it early? So especially for breast, there are 4 ways of doing it. One is by doing breast self-examination. So for all the ladies who are sitting here, there are few who are probably younger than 40 and there are few who are over 40. Any lady who is having her periods going on, after 10 days from the period, should actually stand in front of the mirror or when she is in a shower, apply soap nicely and try to feel for each and every part of the breast, whether it's inside, outside, lower out or inner side, and then behind the nipple, and feel for whether you feel any lumpiness or you feel anything different. Is the nipple looking different? Put your hands behind the head, see whether both the breasts are going up equally or not. For those ladies who have completed their periods and who are menopausal, just choose one day of the month. First of every month, make a check of the breast, see whether all sides, everything is looking normal, see behind the nipple areola, see if you can squeeze anything, any nipple discharge coming. This is the simplest way of doing it. Every day you don't have to do it because every day we are all in that rush, We want to get ready, we have to get the kids to school, we have to get other things done. So that tension every day you don't have to undergo. That anxiety, the रोज करने की जरूरत नहीं है. So just first of every month, Those ladies who have undergone menopause decide first of every month, हर एक part of the breast को examine करना है, and those ladies who are having their periods, say 10 days or 15 days after the periods, try to feel any lump in the breast. Second way is clinical breast exam. Clinical breast examination का मतलब ये है कि once in a year you go to any doctor, whether it is your GP, whether it is your gynecologist, whether it's a female breast surgeon like me or a male breast surgeon, whoever it is, but once in a year get yourself examined by a doctor. Monthly you do it, once in a year get it done by a doctor. Number 3 is mammogram. Mammogram, if those people who are not in the medical industry and who don't know about mammograms, mammogram is nothing but an X-ray of the breast, where both the breasts are pressed together and then an X-ray is taken. And I'll show you, I showed you about that anatomy, that purple grades and all, I'll tell you what the importance of that is. So one is that mammogram, which has to be done every year. And ultrasound is if you feel something unusual for a younger patient, we will do something called as a sonography of the breast. Next slide. So these are just a little technical things. There are various forms of mammograms. You have 2D mammograms, 3D mammograms, you have ultrasound, you have MRI. Next. So this is just an important slide which says कि mammogram अगर करना भी है, there are a lot of myths about mammogram कि mammogram बहुत painful है, करना ही है क्या, no news is good news, अगर हमको lump feel नहीं हो रहा है तो why go through a mammogram and everything. But mammogram is something where before you feel a symptom, we can catch it at a much earlier stage. So for example, like Dr. Sachin was saying, in the West, there is very clear screening protocols. So when I hit 40, at the age of 40 in US, the hospitals start coming behind you saying that mammogram karna hai, you have turned 40. And then if you don't do it that particular month and you are late by another month, then the GP office starts sending you an email. If you don't do it within 1 month, then the GP's office starts giving you a phone call, mammogram miss ho gaya, mammogram. And if you are 2-3 months late, then the insurance company stops your insurance. So that much strict they are about screening. And the reason is, if you catch that so early, we are able to catch 2 mm, 3 mm cancers, where just one small surgery and you are completely cancer free. यहाँ पे क्या हो जाता है, because we don't feel it, we feel okay, what is the need, why to go for a mammogram, okay, why are we spending 5,000 rupees on it, and then it's going to press, it's going to hurt me, this and that. And that is when by the time already एक lump form हो जाता है, इसका मतलब already we are talking about stage 1 or stage 2. These are the tumors which we are catching at stage 0. What is important in this yellow color is, recently New York Times came up with an article that above 50, so there was little confusion, कौन से एज में मैमोग्राम करना चाहिए, 50 years में करना चाहिए, 40 years में करना चाहिए, every year करना चाहिए, every 2 years करना चाहिए. But they found that especially in India also, in US and UK we see breast cancers 50 years and above. Unfortunately in India we see it 10 years ahead. Means we are seeing that 40 to 49 age group. And the ones that we are seeing are a slightly aggressive form of cancer. So that is why it is very important that we should do these mammograms starting at the age of 40. At least एक baseline mammogram करके रखना चाहिए, and then we can see depending upon whether every year you need it or every 2 years you need it. So all women, whoever are sitting here, if you have turned above the age of 40, Elena will circulate some coupons to you, which you can come and you can do it at our institute, which we are offering for free. Or if you have somebody in your family whom you want to give it to, you can give that. For age limit for starting mammograms is 40, but stopping all over the world is 75. 75 के बाद किसी को mammogram करने की ज़रूरत नहीं है. क्यों नहीं है? इसका मतलब ये नहीं है कि 75 के बाद you don't get breast cancer. But the only reason is after 75, those tumors are so slow growing that it is not going to harm your life. Whereas the typical 40 to 70 is the ones where suddenly those tumors may be quite aggressive. That is why we are trying to catch it with this screening. Above 75 it is slow growing, so we don't need mammograms. Next. So I was showing you about, so what does a mammogram looks like. So if some of you are nurses here, and I'm sure if some relative asks you, hey hey, what is it, what is a mammogram and everything. So this is what is a mammogram. It's an X-ray of the breast. If you see that A, B, C, D, right? A is a lady who is probably much elderly, so she may be 60, 65, something like that. Remember that first picture where I showed you where the purple grapes and then the yellow fat. So mammogram becomes more clear अगर fatty content ज़्यादा है and glandular content कम होता है. That is why we start mammograms at an elderly age, means after 40. So for example, if you see that A, it means that it is a fatty breast, glandular element कम है. Probably B is somebody in her 30s to mid 40s because glandular element फिर भी थोड़ा है, menopause हुआ नहीं है. C is somebody who is very young, so probably in her 20s to 30s. As you can see, more white you are able to see. That means glandular element ज़्यादा है. And D is somebody probably in her 18s or 20s. That means there is so much of milk and glandular element कि उसमें अगर हमने मैमोग्राम किया भी तो वो छोटा सा जो ट्यूमर है वो दिखेगा नहीं. And that is the whole reason why we don't do mammogram so early in age, because the density of the breast is so much that कोई छोटा मोटा ट्यूमर दिखेगा नहीं. That is why above 40 the emphasis is on doing these cancers. Next. So if any of you are nurses or physiotherapists and somebody from your family or somebody from Kerala says, hey, mammogram karaya hai, can you tell us what it is? So at least these are a few things which I think you should know, because you can impart that knowledge to somebody else. So like in school, as the grades go higher, we feel, oh, that's very good. Unfortunately, in my field, as the grades go higher, it's not a very good sign. So if you see, go back. So if you see category 1, 2 and 3, that means it is non-cancerous. But category 4, 5 and 6 means it is cancerous. So the higher the category, the more it is coming towards me. So if somebody just asks you, hey, ऐसा हमारे पास एक report आया है, what do you think it is? At least tell them to go and meet a doctor. So if somebody says, I have this mammogram report, this BIRAD scoring system is the same all over the world. So if you have somebody who has a relative in the Middle East or who has a relative in US or UK, somebody shows you a report, definitely ask them if it is a higher grade to go and see a doctor. Next. So what is the risk of breast cancer? So one of the things about breast cancer is, for example, Dr. Sachin was telling about smoking and he was telling about tobacco and everything. Unfortunately, breast cancer, we don't know the cause. So the commonest cause for breast cancer is unknown cause. So for example, if you take 95 to 97% of the times, we don't know the cause. It is not that maybe a few of us may smoke or drink alcohol once in a while, but it's not a common thing. It is not contagious, it is not spread by anything. Then how do we get breast cancer? Unfortunately, we don't know the cause. That is why there is nothing we can do to prevent breast cancer. What we can do is early detection. Early detection, early detection, early detection. That is why I keep telling, we have to do this breast self-exam, we have to do this mammograms, we have to do ultrasound. Only because we don't know the cause. If we knew the cause, if we knew it was tobacco, if we knew it was smoking, we could have just said, okay, stop smoking, you won't get breast cancer. Unfortunately, that is not the case. Next. Having said that, there are still some risk factors which have been found to increase the risk of breast cancer. So what is that? Obesity, diet, unhealthy lifestyle, physical activity and reproductive status. So how can we at least somewhat balance it out? Again, lose weight, do regular exercise, eat a balanced diet, do good physical training and avoid alcohol. Again, this is just a small component of it. Despite doing all this also, it does not mean that breast cancer nahi hoga, but obviously we can reduce the risk by doing this. Next. 5% I told, right? 95% of the times we don't know the cause. About 3 to 5% of the times there is a genetic component. So let us say if there are 2 family members with breast cancer or somebody who had breast cancer at an earlier age, maybe in their 30s or 40s, there is a small chance that gene hai jo travel kar raha hai in the family. So that is one of the commonest ones which we know is the BRCA gene, BRCA1 and 2. Probably, I don't know if any of you must have heard, in 2016, Angelina Jolie came forward saying that she had BRCA gene positive, and that's why she underwent what is called as a preventative mastectomy. That means even before she got the cancer, she got both the breasts removed. Again, that brought a little bit more light to people, so people understood that genes maybe ye ho sakta hai. Very, very small component, 95% of the times we don't know the cause, but 5% this could be one of the reasons. Next. So whenever there is a diagnosis of breast cancer, what are the things we do? First, we take a good history. We find out if there is anybody in the family, anybody who has got breast cancer, ovarian cancer. We do a risk assessment. We do either ultrasound or mammogram or an MRI to see what is the extent. Then we do a biopsy. Biopsy is nothing but a needle test to confirm that cancer cells usme hai ki nahi. And then what we do is, once we know that there is a cancer, we also are interested to see ki stage kya hai. Like for example, Dr. Sachin mentioned, if small things through the bloodstream can go elsewhere. So that is why we need to see कि lung, liver, bone या brain is typically where these breast cancers go to. So we normally do a CT scan or a PET scan to see कि कहीं और फैला है कि नहीं फैला है. So this is again very technical. It is just to stage what the tumor is. Next. Again, the higher the stage, the poorer the progress. So if we catch things early, like in stage 0 or stage 1, it is a very, very good chance of having a very normal life. Even with stage 4. So I don't want you to get scared of cancer as such, because if in today's world, if in the last 15 to 20 years, if there is any one cancer which has done so much research, so much advances, that if Jesus had to come and say, I am going to give you a cancer, choose which one you want, I would say breast cancer. Because the amount of work that has gone in the diagnosis, in the treatment, even for people who has got brain metastasis, liver metastasis, we have so many wonderful treatments now that I would choose breast cancer. And for males, I would say prostate cancer, because it's a very, very slow growing cancer. Next slide. So general principles, already Dr. Sachin had mentioned, for any cancer, we do 3 things. One, we do surgery, one, we do chemotherapy, and one, we do radiation. So surgery is typically to take out that cancer or the tumor. Chemotherapy is given to actually take care of it from spreading elsewhere. So actually chemotherapy is your best friend, because it is trying to tackle even those small cells so that it does not go and spread anywhere else in the body. And radiation or light treatment, as we call it, is mainly to take care of the local area so that local recurrence does not come back. So these are the 3 ways we manage patients. Next. Next slide. So this is a little bit of a disturbing picture. This is a picture similar to what Dr. Sachin had put up. This is a lady in 1811 in Paris, where at that time even anesthesia was not available. So imagine the lady is just lying down and somebody is trying to get the whole breast out, because at that time she had that cancer. Thankfully, we are not in that stage now. Next. We have very small surgeries which we can get away with. So what we call as breast conservation surgery, or also called as lumpectomy, where wherever the tumor is, we just take out the surrounding amount of small tissue and we take out 1 or 2 lymph nodes from the axilla. However, there are certain circumstances where maybe there are small other suspicious areas, so we may have to take out the entire breast, what we call as a mastectomy. Next. So this is an interesting patient. I won't go too much in detail, but this was an 85 or 87-year-old lady who had come to me in New York. And imagine, she did not feel any lump. So this was a mammogram detected. Let me see if I can do this. This was a mammogram detected small tumor that you are seeing here. So what we ended up doing is, because I could not feel that tumor, I had to put in a small wire. Probably you will not be able to see it in that one small wire, and just make one small incision near the nipple and take out that tumor. Next. So as you can see here, there is a small wire which we have placed, taken out a small incision, just taken out that tumor. 2 hours later, the lady went home, no problem. Next. So that is the tumor, that is the wire that we have taken out, we have stitched her back. So it is not a mutilating surgery, it now breast cancer can be taken care of very, very well. Small surgeries, less pain, patient goes home the same day. Next. So these are a few examples. These are a few examples where we have something called as oncoplasty. So if there are some of the nurses here, they'll know that oncoplasty means where we try to do some plastic surgery procedures, try to put the things together back and try to give them as much shape as possible. So this is also if the tumor is slightly bigger. Next. If we have to take out the entire breast, then there are various ways we can do reconstruction. So we can use the patient's own body tissue. So for example, in this lady, we had used her own lower part of the belly. It's almost like giving a tummy tuck. Or you can use implants, external implants, and we can use them for reconstruction. Next. Lymph nodes are like, remember those green dots that I showed you in that first picture? Lymph nodes are something where the breast cancer first spreads to the lymph nodes. So those are small lymph nodes. If we catch in an early stage, we try to take out and see whether or not breast cancer is there. Next. Unfortunately, in India, we see very advanced cases. I don't want to scare the children. Next. This is also another advanced case where one of these ladies had come to me from Bangladesh, and at that time, I think Ramzan had just started, so she was unsure whether she wants to take any medications or no. And I know that it's going to start now, so probably we'll have a similar situation. But we had just started her on tablets, and that too just for 15 days. That also she said, okay, wishy-washy, I'm taking, not taking. But imagine, within 15 days, the entire thing had disappeared. So that's what I'm trying to tell you, that even if it is advanced stage, we have so many curative treatments available now that it is very, very easy to cure breast cancer. Next. 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 Okay. So, standard approaches, we want to catch it as early as possible. We want to make sure that we are able to take it out completely. If the tumor is bigger, like the way in some of those pictures you saw, then Sachin will come in, he'll give little chemotherapy or targeted therapy, we'll shrink the tumor and then we'll do the surgery. And after that, we'll give some sort of radiation or adjuvant treatment so that the cancer does not come back. Next. So at HCG Hospital in Colaba, we are not a multi-speciality hospital, we are a single speciality hospital. So all we deal with is only cancer. So ऐसा नहीं है कि हम orthopedic भी कर रहे हैं, gynec भी कर रहे हैं और कुछ भी कर रहे हैं. We are dealing with only cancer, and we have an extensive array of all the consultants. So we have surgery, we have radiology, we have pathologists, we have genetic counselors, we have medical oncology, radiation oncology, plastic surgery. We have psycho-oncology where Rena takes care of all our patients, and we have a multidisciplinary tumor board जहाँ पे हर एक patient का we do an assessment to see what that actual treatment plan can be, because for somebody very young it could be very aggressive treatment, whereas somebody who is 85-90 years old the treatment could be very, very different. So पहले जैसा नहीं है जहाँ पे हर एक कैंसर पेशेंट को कीमोथेरेपी लगता था या हर एक पेशेंट को रेडिएशन या सर्जरी लगता था. Now we are able to tailor make it according to the precise type of tumor and the age of the patient, general condition of the patient. Next. Again, essence is no, next slide please. Essence is that main thing is breast cancer is the #1 cancer in India also. Cervical cancer till about 10 years back used to be #1, but what has happened is with the increasing number of pap smears and everything, so government bhi kara raha hai, and I am sure now you have heard about HPV vaccine. So please, if you have daughters and anybody who has not been vaccinated, please make sure that HPV vaccines they are getting vaccinated. Again, the only one preventable cancer with a vaccine is cervical cancer. So make sure that if your daughters have not taken or your sons have not taken, please make sure they have taken HPV vaccine. But in breast cancer, what has happened is breast cancer has now taken over cervical cancer in India. So breast cancer is number one. So that is why it is very important. We are able to catch these things much early. Importance of screening, importance of doing breast self-examination, going and seeing a doctor once in a year. So have a proactive approach, and obviously it takes multiple parishes to put all of you together and for father to be able to be giving you all these things, right? So similarly, for breast cancer or any cancer, it takes a teamwork, it takes a village for all of us to treat these patients, but we can come out of it successfully, and we can have people as normal a life as possible, like the way we are managing hypertension or diabetes. So with that, I want to thank all of you for your attention and thank you for giving us this opportunity. Thank you.